Hi everyone, welcome back to Herky the Cavaliers channel. I'm back with Herky and Milton, and we have Dr. Jerome Benamou with us, and if you didn't know, he is Dr. Rebecca's spouse. So how cool is that you guys are together and doing the same profession and everything? So welcome to our channel.
Thank you for having us, actually.
Of course.
I was gonna say
she's right behind the camera now.
Yeah.
So
She's supervising.
So I'd like to know how you got into the profession and why you chose to be a veterinary surgeon.
All right, so it's actually a weird story, but my mother used to be a human anesthesiologist.
Okay.
So when I was young, she used to come back home after a long day at the job and telling me her stories about the anesthesia that she's performed during the day, and I was like, it's interesting. And I was very young, so I was not really allowed to go in the OR and stick around and see the surgeries, but I was kind of interested in what she was doing. Getting a little bit older, she started to show me a little bit more of the hip replacement she was she was doing. She was not doing it because she was an anesthesiologist, not a surgeon, but she was working with orthopedic surgeons mostly. And then I got interested in the surgery itself, but I also wanted to be a vet, so I kind of mixed both, and when I started to study veterinary medicine, I already knew that I was going to be a surgeon because that's what I wanted to do mostly.
Okay, so you studied in Belgium, you said?
Yes.
Okay, so you did vet school in Belgium, and then you knew you had to come to Canada to meet Rebecca.
Exactly. So yeah, I graduated in 2008, and I had the choice. I knew I was going to do surgery. I wanted to do a specialization in surgery, so I had the choice of doing it in Europe.
Okay.
It's called the European College of Vet Surgery, and there's also the same organization for North America, which is called the American College. And so when I had to make this choice, I was like, so either I stay in Europe and do this, I'll need to find a residency and stay in Europe, or I try to travel a little bit more and see other stuff, other things. And also the American college, it's kind of more worldwide. It's recognized a little bit, more.
And you're also a specialized surgeon, not an orthopedic surgeon. And so you do all sorts of surgeries on dogs. What's the most common type of surgery that you perform?
As Rebecca said a little bit earlier, we do mostly orthopedic surgery because it's the thing we see the most. Cruciate ligament surgery is the most common orthopedic surgery we do.
And that is not ACL. That's
ACL.
Oh, it is?
Yeah,
okay.
It's called cranial cruciate in dogs. It's called anterior cruciate in the human side, but it's the same ligament.
Oh, gotcha.
Yeah.
Okay.
The surgery is completely different in human than in dogs, though. Okay. But it's exactly the same ligament.
Oh, okay.
Pretty much,
okay.
Yeah.
Gotcha.
And dogs tend to break this ligament very often. Like we see that probably 5 or 6 times a week, pretty much. So we do that a lot. So orthopedic surgery is the most frequent type of surgery we do, and it's probably why you guys and not only you, pretty much all of our clients think that we are orthopedists, but we do pretty much all surgery because our college, our specialization is really focused on all type of surgery.
Yes.
And we have an exam based on every type of surgery. It could be neurology, could be oncology, cancer removal, basically. GI surgery. We do pretty much every type of surgery.
So you can do neuro also.
Yeah.
And ortho and soft tissue.
Yeah, and sometimes we do the 3 in the same day. So
really?
That's the fun part.
Oh, wow. Yeah. So since we talked about luxating patellas a lot with Rebecca, I thought I'd talk to you about other surgeries today. And so since our audience is widely Cavaliers, I wanted to discuss more Cavalier specific issues. So for example, we had a friend that was just crying out of no reason when you touched her butt. So immediately I was like, I know what it is. It's an infection of the anal sacs. And so we know this because we've had other friends had infections there. So they tell us, go get the anal sacs expressed every few months. And so this girl didn't know. And so what can happen if there's an infection of the anal sacs, basically?
So actually it's definitely it's not comfortable. So the first thing is discomfort, can be pain. So they tend to try to scratch their butt on the floor, and that's the first sign you will definitely see. if you go a little closer and you look at the region, you'll see some redness, swelling sometimes, and you can see some pus or discharge.
Okay.
So that would be the typical signs you
can probably see it yourself at
definitely.
home.
Oh, yeah. If you see that your dog is interested in scratching the butt region, there's something to take care of. Sometimes it's minor. It's only like a minor little things that will not last and that does not necessarily need a consult with a vet, but sometimes it's a little bit more dangerous to wait and then seek for a consult would be a good idea. So it's called anal sacculitis. Okay, sacculitis is just a word to say that there's an inflammation in the anal sac. It can be one or two because dogs have two anal sacs. And the first thing would be to try and express them, and if it's not enough, it can.
Or do you recommend people trying to express their glands themselves at home?
It's a good question. Some people could, but it takes practice, I would say. So I do not recommend to do it unless a vet told you how to do it and showed you how to do it, because it could be fragile, and if it's an abscess, you don't want to do it. You want to treat the abscess or the infection, obviously, with thorough flush, antibiotics, and wound treatment, because it could turn into a wound. Okay. That could definitely become an abscess and go through the skin, and you will definitely see some discharge in the area. So.
When do you come into play?
So the role of the surgeon for anal sacculitis is really the end of the story. So if it becomes very recurrent, chronic, and tough to deal with simple medical management, then we can definitely remove the anal sacs. So that would be the end of the problem, because we remove the source of infection, but also, we come at the end of the problem because it's also a big surgery.
But is it a necessary gland?
Can they live okay without?
They can live okay without a gland. It's not really necessary. It's mostly like a territory thing, pheromones and stuff like that. So it's not really important. And some dogs will tend to do like anal sac infection pretty easily. So removing them would be the go-to for these dogs, definitely. So as far as anal sac infection, there's also something I wanted to say, because most of the people will start by thinking, okay, there's an infection because it's the most frequent problem. Sometimes we can also see more dangerous conditions in this region, and it could be a mass, and most of the masses that we see in the area are cancer. So it's very, very important to make sure that it's not cancer and not treat this yourself without seeing a vet, because if it is a cancer, the sooner we go to surgery to remove it, the easier it is, and we can get like margins, which means clean tissue around the mass, which makes the excision, so the removal of the mass, more complete. And the bigger the mass, the less it's feasible or easy to remove it completely. And if we don't remove it completely, then we leave some cancer in the surgery site, and then it will regrow very easily, very quickly. So. And
for every surgery, though, are you the ones doing the anesthesia?
Anesthesia. It's a good question too, because anesthesia is it's a big part of our job, because we need to make sure that the anesthesia the patient is stable during anesthesia, that the heart rate is okay, that the blood pressure is okay, breathing pattern is okay, and we monitor pretty much everything like in human surgery, human anesthesia. So it's very, very important. It has become that important that now we have an anesthesiologist to help us. And he will definitely make sure that everything goes smoothly, so we can focus more on our surgery. So it's a lot easier.
So many things to manage otherwise.
But it's fairly recent though, because till fairly recently we did not have an anesthesiologist, so we had to manage everything. Although we have technicians doing the technical act of giving drugs, of doing the actual monitoring, but it went through us to call decisions during the anesthesia. Like, we have hypotension, we need to give like this and this to control.
Because there's a big scare worriness in the Cav community, because the Cavaliers have fragile hearts. So a lot of people are concerned with anesthesia and their fragile hearts. How does the two coexist, or how does it get along?
They don't have a fragile heart as long as they don't have the pathology. I mean, let me be clearer. They are very prone to do some cardiac disease, especially one, which is mitral valve disease. But if they don't have the disease, they will manage anesthesia just fine like another dog.
But let's say they do have that mitral valve disease. Are they more sensitive?
Definitely.
Definitely
The anesthesia will be tougher. They don't deal with anesthesia as easy as another dog because obviously the heart has a lot to do during the anesthesia. And I mean, anesthesia, generally speaking, will decrease the blood pressure.
Oh, the blood pressure.
Yeah, the blood pressure. And it's a bad thing to have a low blood pressure. So we need to give lots of fluids during anesthesia to maintain the blood pressure. And a diseased heart won't deal as good with a lot of fluid.
Gotcha.
Because too much fluid will make the heart work more. And a heart which is in a bad shape basically won't deal as good as a normal heart. So that's the main issue with anesthesia. So we have to give less fluid with cardiac patients and try to deal with blood pressure with other things like other drugs basically. So we definitely make sure that the heart doesn't have to work
that hard.
Yeah, that hard. Sorry, it's not topics that I usually do in English, so I'm kind of
He's doing great. Yeah, thumbs up
Yeah,
if
he's
you
doing
think
amazing.
Dr. Jerome is doing great.
obviously and it's a chance we have. Like, it's very, very rare that we have accidents in anesthesia. It's very rare, but it does happen. It's certainly a risk, and each time we meet a dog owner in consult and we need to go through surgery, we have to let them know that anesthesia is always a risk.
And what kind of risks can you see from anesthesia?
Well, cardiac arrest is the worst.
What's the percentage of?
It's very low. It's probably less than 1 per 1,000 cases, so it's very low.
Okay.
But obviously, it's a lot higher with a dog that has a cardiac pathology in the first place, or a dog that has a respiratory problem. Like, for example, when we do brachycephalic dogs, like bulldogs and flat faces, basically, they have a lot more difficulties to breathe in general. But in anesthesia, and especially during the recovery period of anesthesia, these patients are at risk, because they cannot really breathe well.
Sometimes anesthesia is mandatory. For example, if we talk about like foreign body ingested, you have no choice but
to put them under.
Your dog to sleep and then operate, right?
Like with any surgery, there's no... I mean, in the human side, we have the chance of telling your patient that just sit here, I'm gonna block your knee and you won't feel anything, but there's no general anesthesia. We don't have that kind of...
Oh, like localized...
Local anesthesia.
Oh, yeah.
No, the dog's gonna go crazy.
We'll just freeze the knee and you won't feel it. But in dogs, I mean, even though we could, because we have the same local anesthetics, she won't stay while I'm doing the surgery. So we cannot do just an epidural and get away with it.
Yeah, that's very interesting.
That's why we have to go through anesthesia like pretty much all the time, except very, very minor surgeries. Like if I have to remove like
anal
tiny
sacs,
little
do they have to go under?
Yes.
Oh, that's a big...
That's bigger. Yeah, that's a surgery that takes about 30 minutes to an hour, I would say. So especially if you do both anal sacs at the same time. It's a general anesthesia.
Something we see commonly in Cavaliers and in a lot of dogs, I'm sure, but it's just we're so in this community, is that they ingest foreign bodies and then the owners don't know what's happening. The dog just starts having weird symptoms, and then it ends up being like a peach pit socks in the stomach or in the intestines, right?
Both, both. It starts with the stomach and then it goes through the intestine. So if you take it very rapidly, most of the time it will be still in the. If you wait a little bit longer, it's gonna go through the small intestine, and sometimes it can go through like the large intestine and go out. So it depends on the size of the dog, the size of the intestine, and obviously the size of the foreign body.
And so what are the symptoms that you have to look out for? Like this is a sign that there's a foreign body.
The most frequent signs that we will see is the dog doesn't feel well to begin with. So vomiting is definitely the one that we see the most often, because the intestine is like just blocked and the dog keeps eating sometimes.
Oh, okay.
And even if they don't eat, the stomach and the intestine do, secrete stuff, and so it gets full of fluid and it cannot pass, so the dog will have to vomit.
Okay.
And
do you
so
see
that's the first
diarrhea
sign.
also?
You could see diarrhea. If it's really, really blocked, they won't have anything that goes on the other. Yeah, that comes out. If it gets worse, the intestine can become perforated, and now we will have signs of septic peritonitis, which is very, very problem, grave diagnosis, it's bad, and the dog won't feel well, so they'll be very, very sick.
So that's when the object perforates.
Yeah, so you'll have basically fecal material in the abdominal cavity, so
it's
not supposed to be there.
Oh,
that's crazy.
And that can infect
that will infect the whole abdomen.
Yeah, that's really scary.
That's scary. So it's obviously very rare.
Yeah.
Okay, if you go like rapidly to the vet and do the exam, do the X-ray, and
do the surgery,
and do the diagnosis, and go to surgery right away, it won't happen. And in rare cases, the intestine is not looking good, so we have to remove a piece of intestine and do a reanastomosis.
So it's like you shorten.
Yeah, definitely. So it's rare, but it's kind of we do that probably 20 times a year, so it's not that rare. But most of the foreign body, if you go like early enough, the intestine will be healthy, and you just open it, remove the foreign body, and close it out.
Okay.
Yeah.
And so your suggestion, I'm guessing, would be like be careful with your dog.
Yeah,
and like watch everything that they do, right? Like as much as possible.
As much as possible. For example, we are a bad example because we leave everything everywhere, and we're very lucky because our dog just don't eat it. So we're lucky, and we're not even paying attention anymore because we know they just don't eat. So be careful what you leave on the floor, on the ground. If they do love some little toys, let them play, but under supervision.
Yeah, always under supervision.
That would be important.
For sure. One topic I really wanted to talk about is syringomyelia, which is caused, I'm guessing, by Chiari malformation of the brain, and that's something pretty common in Cavaliers. What's your opinion on that surgery in general, and like what does the surgery entail? Okay, so the Chiari is definitely a malformation of the cranium, especially the back of the cranium, which is the occiput, and the occipital bone is too small for the size of the brain and the cerebellum. Basically, it's this. So because of this, the cerebellum will try to herniate back. And that will not allow the cerebrospinal fluid to pass through the canal, and that will the syringomyelia is kind of a pouch full of fluid because it cannot really pass, basically. So because of this, we have secondary signs like abnormal scratching that we call phantom scratching, neck pain, back pain, and sometimes like weaknesses and incoordination of the limbs. So they can have neurologic signs. It's bad. It's so sad to have like neurological like symptoms on your dog. A lot of friends that we have, they have like those random yelping, and their dogs cry out of nowhere, and it's like such painful screams. Definitely, that's tough to see. So these symptoms are not nice. But the good thing is that mostly medical management is enough. So with cortisone, drugs like gabapentin that will try to decrease the production of the cerebrospinal fluid will help the dog, and most of these dogs, by medical treatment only, will have a good quality of life. Unfortunately, once in a while it does not work, and it does require surgery. It's really controversial because some surgeons will say that the surgery doesn't work that well. But if you look at the more recent literature on the subject, on the topic, some surgeons have very good experience with this surgery, and they talk about like 75 to 80% of good results with the surgery. So it's a surgery that works well. Obviously, it's a surgery I've never done because it's very, very rare to see a case. Surgeons that do mostly neurosurgery and are specialized in Chiari do exist. Okay, I know, like, I don't know exactly where, but in US there's a Chiari Institute or a Chiari Center, and they do that very often, and obviously in their hands that will work better than in mine, because... But so let's say this happens with Herky and Milton, and would you feel comfortable? I would, yeah. Oh, yeah? I would, yeah, okay. because we do, like, surgery that are very close, like we remove masses from the brain, basically. These are stuff we do, but
It's the Chiari.
Okay, sorry, the camera cut again. I'm very irresponsible today with batteries. But yeah, basically, I was asking if this happens to Herky and Milton, would you be comfortable doing a surgery like that?
Yeah, I would have to definitely get prepared because it's not something we are doing very often. Like, actually, I've never done any. I've read a lot about the subject, and I do other surgeries that look like it when we remove masses from the brain, for example. So it's fairly close. But definitely, I would be comfortable doing it, but I need to get prepared. It's not something
I'll do. Prepared?
Well, read a lot, make sure what can happen, probably send a few emails to surgeons that have done a few or a lot, and they can give me some tips and tricks, like be careful with this and that, and make sure to put your screw like this, because when I do it like that, it doesn't work as well. So these would definitely be helpful. And if you're not scared to travel a little bit, I would definitely advise you to go see someone that has better experience, because it's a very specific surgery.
Oh, of course. Yeah.
So probably someone that has done a lot of them will be better than me. That is for sure. And
I'm wondering if I don't know if you know, but if we're insured, like here, would they cover if we go elsewhere for a surgery?
Probably.
Oh, yeah?
I don't see the reason why they won't, especially if you have to travel for this kind of pathology. I mean, you have to, so I don't see the reason why they would not. But again, I don't want to. I don't want to say that at large, because I'm not sure, and sometimes some insurances are different than others, so you definitely have to ask the question before going and before doing the surgery. Yeah. But I don't see the reason why they would not. The reason why we don't do the surgery that often is probably because our neurologists, who are medical neurologists, so they don't do surgery, but they do the exam, neurologic exam, they prescribe the MRI, they prescribe CT scan, and they just have the discussion with their client and decide to refer to a surgeon or not. And most of our neurologists in Quebec, they will treat this condition medically. So as I was saying earlier, with cortisone, gabapentin, acetazolamide, or any drugs that will decrease inflammation and also decrease the production of the cerebrospinal fluid.
And can dogs live comfortably under medical?
Yeah, well, most of them will respond very well to the medical treatment. But again, once in a while, it becomes not enough, and the clinical signs become bad, and then surgery would be required. And
then what do they do then if they don't refer to you? They just...
Well, unfortunately, some of these dogs will have to be euthanized, unfortunately, because it becomes so difficult for the dog to live, and for the owner to just watch this and not be able to deal with it and do anything to make the dog feel better. So unfortunately, that does happen. But it's rare. Okay? Most of them, they will respond to medical treatment. As far as I know, there is no big literature study that has compared medical treatment to surgical treatment. We have numbers with surgical treatment only, but they did not really compare it to the medical treatment. As far as I know, again, I haven't read all the papers all over the world, but...
And so when you do that actual surgery for Chiari, are you just basically making more room in the brain?
Yeah, definitely. It's called a cranioplasty. So you try to make more room in the back of the cranium, of the occipital bone mostly, and also with the first cervical vertebra. And so you try to cut some bone, remove bone, put like a titanium implant to make it bigger, and yeah, that's
it sounds like such an intense surgery, and like I've seen some dogs post-op of that, and oh my god, it looks really scary. Like their whole head is shaved, and I'm guessing the way you describe it, you have to open like a lot of their...
Well, the incision is not bad, because the incision is only like probably like this. But the shaved part, the clipped part will be a lot bigger. It's always like this. The incision is a normal incision. I mean, sometimes it's bigger when we do a herniated disc, for example. We have to open large sometimes. So it's not really the length of the incision. It's more what we do inside that's scarier. Yeah.
It seems a lot, like very scary. And how long is like a surgery like that, you would say?
Again, I haven't done any, so I cannot really say, but I would assume that it's a 2 to 3 hour surgery.
So it's a pretty massive surgery compared to the other ones.
It's and you need to go slow because you don't want to do anything.
Like it's a sensitive area there.
It's a very sensitive area. You will see some brain, so you need to.
There's brain and there's spinal cord and there's. Oh my God.
So it's you need to take your time with such surgery.
Of course.
Yeah.
All right, so I'm gonna wrap up this video here. But if you want Dr. Jerome or Dr. Rebecca to come back on our channel, please leave a thumbs up and let us know what you want to discuss next. I think this could be like a super long series because it's so interesting. And if you want to check out his Instagram and his Facebook, I'll also be leaving them here. And just so you're aware, like there's some like scary images on there, so it's not for like really. The faint of heart. I find it a bit difficult to watch, but so thank you so much for coming on our channel. We really appreciate it. So we'll see you soon. Bye.
Expression, is that correct?
Extraction.
No, it's not extraction. It's
I don't know. Comment on peut dire express?
Il y a trop de bruit, hein?
What?
Herky, stop. Oh no! That's scary.
Sorry, Herky. Sorry.